Good morning. This is the weekly Debrief podcast from FingerLakes1.com. I'm Ted Baker. I'm joined by my colleague Josh Durso. Good morning.
Good morning.
Not really much to talk about this week. COVID-19's over. I mean, no major announcements. Oh, wait, we're getting an update.
Yeah.
What? I really try hard to give the benefit of the doubt to our elected leaders. But what in the world was Kathy Hochul thinking? First off, note to all our fellow media, stop calling it a mandate. A mandate's when you make someone do something. This is a pretty please at best. Mask mandate takes effect Monday morning. By 10:30 Monday morning, she's out with a release saying we're not going to enforce it. After counties started bailing out, I wasn't sure which was going to happen first, Chuck Schumer visiting all 62 counties or all 62 opting out of the mask mandate. What was she thinking?
You know what? I think she went into it probably with the best intention, except the difference is now, unlike last year when we saw mask mandates and things like that come out during the Cuomo administration, people feel significantly different about where we are in the pandemic now. You can say that, yes, Omicron is very serious. Yes, we have all these different things that are converging at the same time, meaning hospitalization rates increasing, things like that. But at the end of the day, as more and more of the population becomes vaccinated, people are getting more and more tired of these types of restrictions. And by the way, when we think about mask mandates, first time around, counties were left holding all of the grief and all of the trouble for it. And I think a lot of those county executives and administrators, especially in small rural counties where health departments are, staffs of maybe like 6 to 10 people, said, we can't adequately enforce this, so I hope the state's going to send some help. That was very clearly not going to be happening from the jump when Hochul announced that it was going to be on counties to enforce. And what you're left with is essentially a request for an Erie County-style mask mandate to be really executed and enforced by the counties and requested by the state. It's interesting because last night Seneca County was sort of the final county to more or less, I suppose, say they won't be enforcing it very, very rigidly. Even though it's technically on the books and being called confusingly a mandate. I think it's interesting, just as a side note to people who've been watching and listening, you will not see the words mask mandate appear next to each other on Finger Lakes One unless it is in quotes, because it is not a mandate by any measure. Like it just is not.
Right. I started referring to it in our reporting yesterday as what Governor Kathy Hochul calls a mandate, because it simply isn't. But so if it isn't, that begs the question, do we want our government in the business of advising us? Should they either make laws or don't? I equated this mandate to the traffic advisories we get in the winter. All the sheriffs come out when there's bad weather and say, we've got an unnecessary travel ban. But yet the 7-Eleven is still open, and the guy who's got to work there has to get on the road and go to work. I mean, there's no teeth to it. I think we're tired, and I'm going to sound conservative here, as I sometimes do. We're tired of government thinking it has to have a role in every single aspect of our lives. If you want people to wear masks, then run some public service announcements and say, please wear masks. And those will be just as effective as the ones saying, please get the vaccine. Those who want it, have it. Those who don't have it, don't want it, mostly, not completely. But back to enforcement for a minute. Let's look at one of the counties that says it is going to enforce. Cayuga County, we're going to enforce it. The report I heard today was that they're going to enforce it with education and a stern warning, and then maybe at some point down the line a $50 fine. So remember when Wegmans in Auburn got fined $50? So if I walk into a store in Cayuga County with my mask fully on properly, and I walk down to the back aisle and pull it down and go around the corner and there's an inspector, the store is going to get fined $50 because I pulled my mask down. It's not workable. I mean, at some point, government has got to say, will this work? And if the answer is no, then maybe you don't do it.
Yeah, I think going back to your original question about whether advisories should be issued, I'm fine with advisories. Just don't call it a mandate. I think it's fine that the state government want to put out suggestions about best practices and things like that, especially when we're talking about something as serious as a pandemic. Now, the flip side of it is there really should be this pragmatic evaluation of any advisory or something that's going to be called more seriously a mandate about whether it can be used, if it even is a tool for local communities to use. Now, you mentioned Cuyahoga County, Monroe County, also going to be enforcing it. Same method. They're going to do the education first, and I don't think any county, even the most blue of counties in terms of leadership, I don't think any of them want to be in the business of fining businesses.
Right, and that's what they're saying here. With all this, what they're saying is, please, people, don't make us do this. And you kids, don't make me stop the car.
Well, in using Monroe County as an example, there you have a community with a significantly larger health department, far more resources, but still not adequate resources to enforce equitably, to use a phrase that we hear a lot in the news today, or effectively. Monroe County, population 750,000. It's not going to be possible it wouldn't be possible for a department of 100 people or 200 people or 300 people to effectively enforce that kind of rule across a county like Monroe County. It does really come back to how enforceable is this, and God forbid, I really hate to say, I know this has been really politicized already, but I hate to see the first county that dare actually fine a store or a business, because they will be in for an absolute terror of a time, because people are going to come back and say, well, I've seen dozens of people in other stores, and I'm going to say this, I live in Monroe County, and I've been in Target, Walmart, and Wegmans in the last 72 hours, and 72 hours ago, there wasn't a mandate. But 12 and 48 hours, or 12 and 24 hours ago, there were. And the number of people masked was completely the same throughout all of those time periods.
See, that's interesting, because that's not the experience I had. I was in Wegmans in Geneva, I think it was on Monday after it took effect, and I noticed a distinct increase. Almost everybody was wearing a mask. It stood out when these 3 or 4 young guys came in that weren't wearing them. So, I guess that kind of goes place to place.
Well, and I think this kind of boils down to the politics of it. I live in Webster, near Penfield, and we frequent Pittsford and those communities. And I will say, you're going to see a different outcome in those places.
And those, I'm guessing, are probably on the higher end of vaccinations.
They're the more affluent communities in Monroe County. I think if you go to the city, you're going to see more masking. You're going to see more willingness. In the suburbs, where you have a denser population of Republican voters, you're going to see less masking. I would say that just judging from what I've seen over the last 2 days, it's a 60-40 split. 60% of people you see or come across in your big chain stores, things like that, are masked. 40% are not. You've got the big signs, you've got the big bold messaging that says masks are required, but at the end of the day, there's absolutely no enforcement happening in those places, and who can blame them? Who can blame a sales associate who works at Walmart or Target or any of those places and makes $15 or $16 an hour? Why would they want to engage in what would become, in most cases, a very ugly situation for them and for everyone around them?
And at the end of the day, how well does this work? We're back to the theater of walking into a restaurant. I have to have my mask, and the minute I sit down, all 75 of us in this restaurant are sitting there without masks, spreading virus into the air if we have it.
So I think the big thing to me, where this mask mandate or mask, whatever you want to call it, really falls short, is the point where it wasn't also met with some sort of capacity restriction guidance anywhere.
But we
literally
see
anywhere.
that Kathy Hochul, everybody learned, I think, from the Andrew Cuomo restrictions, nobody wants to go there. People don't want it. Businesses don't want it. State government doesn't want it. They will bend over backwards in any justification they can come up with not to have to do capacity restrictions, shutdowns, or any of the stuff we saw in March and April of 2020.
But if we're talking about things that would actually work, if there is a high,
but we're not.
if there is a high volume of spread happening in these venues where masks are now required, and it isn't happening at home, which is the fact, like it's happening in home environments and large group settings in personal spaces that the government can't govern, then capacity restrictions would be the answer. It wouldn't be just put a mask on and continue to gather in groups of hundreds or whatever the case might be with no regard for a mask once you sit down. I mean, that just, that's where it falls flat.
And that's why the skeptics see this all as theater. And that's why it angers so many people, because it doesn't really make sense. It isn't geared toward limiting spread. It's geared toward the politician's instinct to be seen as doing something. It's more important, if I'm a governor, I care more about being seen as doing something effective than actually taking some time, thinking, gathering my experts, and doing something that really does work.
Question then, what does this do for Governor Hochul's re-election hopes moving forward? Obviously, this announcement, and one of my skepticisms of this whole thing is that the policy was announced and dropped within 24 hours or maybe 36 hours of Tish James bowing out of the governor's primary race. So, and she was, by most accounts, viewed as her most serious competitor on that front. So that happens. Now we're in this territory of having a statewide mask policy, which is kind of just shoddily being implemented. What does this do to her race moving forward, not just for a primary, but for general election if she's going to make it through?
I can't see how she can lose. I mean, she's consolidated her power and flushed out all of the opposition in the primary. I think if she was going to be beaten, it would have been in the primary.
Right.
The numbers, I mean, I wasn't here when George Pataki got elected, so I don't know how that happened. That was before my time in New York. The numbers are just overwhelming. The only way a Republican gets elected governor is if every single Republican in the state turns out and 3/4 of the Democrats oversleep and stay home. I with all due respect, when's the last time you heard the name Lee Zeldin?
Yeah.
I mean, I guess he's running. That's the rumor I hear. But I don't see it happening. I mean, Republicans will say, well, there's all this anger, but I don't think there's enough of it to overcome the huge advantage in numbers that Democrats have in New York, which is a big part of the problem. I think we can see why it's not good for one party to have a complete stranglehold on a state.
Yeah, and I think it's interesting, actually. We'll wind up talking about this more later, but I think there are some pretty big questions that Democrats should be asking themselves. But first, let's talk about the other COVID-related state item. Governor Hochul says that beds are opening up. Now, I need to preface what I'm about to say with I read a story this morning that showed hospital data is actually going the wrong way again as of yesterday or the day before. But that doesn't change the fact that on Monday, Governor Hochul called it an early sign of success that pausing elective surgeries, I think less than 7 days earlier, resulted in preliminary data showing that hospitalization rates in those troubled regions, the Finger Lakes, Western New York, and some of the others around New York State that were seeing higher numbers, which prompted the pause on elective surgeries, is going the right direction. Now, we're getting this back and forth, obviously, on data like, is it going the right way? Is it going the wrong way? Hospitalizations going up, ICU beds opening up, whatever the case may be. That can be spun a million different ways. But is this the modern method of walking back an unpopular policy? Instead of admitting that it wasn't the best idea to pause elective surgeries, you just say, well, it's working. Days later, it's working, and maybe in another week and a half or 2 weeks, we can just forget the whole thing. Everything worked out fine, and resume the elective procedures.
Well, it worked perfectly for W in Iraq, so I guess he's following the same playbook. I had no idea that there were so many people getting nose jobs and tummy tucks. But what I find interesting, we talked about this last week, her release doesn't talk about staffing as much as it does about beds. And I made this point last week. If a hospital is at 95% capacity in its beds, that means everyone who needs a bed has one, and there are more left over. Now, again, and you brought up this point, that doesn't mean if there's a sudden surge that we don't have a big problem. But at the moment, we don't. So I find it hard to believe that a 7-day pause on elective surgeries, and remember, surgery nowadays, I mean, people have half their body replaced, and they're home 2 days later and walking around. So I don't, it seems to me a way of saying, you know what, let's see if we can kind of kick this one to the curb and make everybody forget that it ever happened. But I want to go back. You were talking before about where we are in the pandemic. Mm-hmm. Where are we in the pandemic? You know me in cases. If I could do one thing in the rest of my life, it would be to get the media to stop talking about cases. Cases are positive tests. The more tests you do, the more cases. I saw a story the other day. Cases up somewhere 50-something%. I'm guessing tests were also up about that many percent. Where do you think we are? I use that number. I look at the rolling 7-day average of COVID deaths. I just checked it this morning. It's 13 in New York State. On May 27th, it was 12. That number hasn't moved. So maybe more people are getting COVID. If they are, I don't think they're getting as sick, or at least they're not dying from it. So I don't think we've even come to agreement yet on the right way to measure where we are. So how do we get a reliable picture of where we are? We have to know that before we know what we can do.
I think it comes back to better communication of how severe cases are. And I don't even necessarily know that it's hospital capacity is the best way to go, because the for-profit healthcare system in the U.S. has essentially just stripped down hospitals and our healthcare system overall to just a bare bones skeleton that isn't really well equipped to handle any kind of crisis. You can go back and see the headlines about the flu in years past where, there were years when, hospitals were really stressed because of just the plain old flu. So there's that part of it. And I also think moving forward, there's talking to a friend a couple days ago about this, and we were trying to figure out what percentage of the population is quote unquote over the pandemic. So meaning they're done with the policies. They don't really care what latest variant is that's running rampant in the community, irregardless of how severe it is, that sort of thing. And I think it kind of falls in line, honestly, with the percent of population that is vaccinated. And I would say at this point right now, we can safely say that 60 to 70% of the population is more or less over the pandemic. Now, what does that mean? I mean that they're protected, they're willing to get a booster shot, or however many booster shots they need to get, and they're, for the most part, just living their life. If they have to wear a mask when they go to the store, they don't really care about doing that. That's fine. They'll put it on, whatever the case may be. I think when you really start to isolate out the groups of people who feel that the most extreme severe measures to protect every single person from any case of COVID are isolated out away from, and also the folks who want to see no restriction in place at all, you're left with a pretty significant majority of the population that is going to become comfortable with just living with COVID existing, because we're not going to eradicate it. So to answer your question, I would say we're probably 4 to 6 months away from seeing policy really shift away. Because let's also dial back a little bit here and say this. Obviously, the governor painted a picture between yesterday and the day before that more severe measures could be necessary, shutting businesses down, things like that.
But do you think she really believes that, or is that just simply a way of saying, please do this, don't make me... I think
making that statement without any kind of real policy behind it is just catering to a base of voters who do not want to see the measures disappear at all.
And keep in mind that a lot of those people are pretty far to the left, which is her natural constituency.
And the problem is none of the broad policies that we saw during the pandemic, like during the beginning of the pandemic, are being extended or being continued in a way that would suggest that things like shutdown are even possible or on the plate as far as things that could happen in January or beyond. The eviction moratorium comes to an end in January. January 15th, I believe, is the cutoff on that. That's a New York State policy. Kathy Hochul, as governor, could easily act on that and move that forward if she really believed that shutdowns were coming after this next round of holidays. Another one. Joe Biden is not going to extend the pause on student loans. Those student loans are going to have to be repaid beginning February 1st. And we're seeing, I think, how do you gauge where we are in the pandemic? I think you look at the bigger policy pieces and you watch what the federal and state governments are doing with those issues, and you pay less attention to the COVID-specific policies that are happening, because as the other broader policies continue to move forward and show signs of post-pandemic life, I think that is going to be the real signal that this is more or less we're choosing to live with it and moving on.
Well, and let's go back to Omicron for a minute. The indications that I'm seeing, and we saw this to a degree with the Delta variant, is that this variant is more transmissible, but generally less serious. In fact, I've seen some reporting suggesting that where we're heading with COVID is it's going to become a regular part of our lives, but a less serious illness. As we move forward, and I think we brought this up a little bit last week, we may never be done with this. This may be just the new part of life, but at some point it becomes more like the flu, where it's get your shot and don't get sick. It seems that as each of these variants come out, and again, whether it's vaccination or natural immunity from getting it, the longer it's around, it would make sense that more of us are going to develop some sort of immunity to it.
And again, I say this over and over again, because I'm sure there are a lot of people listening who don't like what I've said so far about this pandemic, is the focus needs to be on making our healthcare system more robust so that it can handle a COVID that isn't going away. Yes, there will be, maybe with this strain, there's going to be less hospitalizations, or maybe it's less severe, but it is going to spread just as much. And I think we're going to continue to see at least a moderate amount of hospitalizations because of COVID. So if there is going to, for example, in a small community the size of an Ontario county or Cayuga County, if there is going to be this constant need of 1 to 3 dozen extra ICU or hospital beds because of that, then the healthcare system needs to adjust and not just continue to look ahead and say, well, the only viable solution is to vaccinate everybody or lock everybody down, because there's just that part of it's unsustainable. What we can do is add hospital beds by just spending a few dollars, and we can be more prepared to adequately deal with not only this pandemic, but all of the health-related issues that America is going to have to reckon with today, 10, 20, 30 years from now.
And these problems were, again, this was starting way before COVID. I think the healthcare industry has, to a certain degree, said, oh, COVID, that's all our problems are because of COVID. These things were happening before that. I mean, Seneca Falls, was it Seneca Falls or Waterloo used to have a hospital? Both. I think Sodus used to have a hospital, did it not? I mean, all these places used to have hospitals, and now Ontario County, population 100,000, has Geneva General and UR Thompson. I don't know how many beds that is, but I'm guessing it's not, it isn't probably even
and
high
Clifton
three
Springs.
Figures, is it?
Yeah,
and Clifton Springs.
And Clifton
yes.
Springs. I mean, we're talking probably, as far as ICU beds, probably under 200. And as far as hospital beds overall, I couldn't give you a number there, but I'm going to guess it's under 500. And again, bad math. How many times have I said that? That's become my favorite thing to say. Bad math. When you have 500 of something in a population of 100+ thousand.
Right. It's not going to take much to put a stress on that.
Literally anything.
Here, I guess, I think we're a lot of, because you were talking about this person that's frustrated with the whole thing, and you kind of described me in many ways. Through 18 months, I have not gotten COVID. I got my vaccine. I'll get my booster here at some point because there's reporting coming out very soon. Fully vaccinated is going to mean booster. You will no longer be able to say I'm fully vaccinated unless you had the booster. I guess my frustration, if I can kind of sum it up in very general terms, our response to COVID has been to treat everyone as if they have it. I don't understand why we don't treat it the way we've treated airborne upper respiratory illnesses in the past. Find out who's got it, test, find out who has it, isolate them from the people who don't. We haven't done that. Instead, we've acted as if everyone has it. And at a certain point, if you're following all the rules and doing everything you've been told, you say, why am I paying a price because some dope wants to walk around with his freedom flag and say I'm not getting the shot?
Yeah, and I think to my end, my one looming frustration is the lack of ability of our existing healthcare infrastructure to deal with what the pandemic has brought on and what any health crisis in general, even moderate one, would bring on. And that's, ignoring the big picture is really problematic. So let's talk a little bit about this jockeying that we have happening in Albany. Tish James is out of the race for governor. She has instead announced that she will be running for re-election for her current job, Attorney General. That prompted all of the Democrats to jump out of that race, including who many progressives that I follow on Twitter saw as a breath of fresh air and Zephyr Teachout. It's interesting because I think this says a lot about where the Democratic Party is right now. But what do you think this means for the part of the Democratic Party who I think wanted to see more progressive candidates be put up? Because unlike every other state in the U.S., they can get elected here without much fuss or trouble. I think the math that you talked about earlier really brings that on. What do you make of that?
Well, I'm going to answer your question with a question, because this is what I don't understand is what happened here. Was it just the polling? A poll came out that had Hochul at 36%, James at 18%. It just seemed awfully sudden to just bail out of the race. So I'm thinking there's something behind the headlines that we haven't learned yet. Maybe it isn't. Maybe it was just the polling. I don't know. I
think it's, from what I've gathered, just sort of reading between the lines and seeing what the establishment is concerned about. And this is, to be clear, this is the establishment of the Democratic Party winning out and regaining control over the party that was looking like it could become a pretty progressive group by the end of next year if things went a certain way. I think this is them playing it safe because of what they're afraid of happening in next year's general election, not just in New York, but everywhere. I think the idea is that there is a part of the Democratic leadership, the party leadership, that wants to see moderate centrist style candidates on the ballot to encourage that maintenance. Obviously, we got midterm elections coming up, and I think Democrats don't want to lose a ton of congressional seats. They want to try to maintain what they have right now, and I think there's concern that if you put too progressive of candidates up, that they will get destroyed or that it will have an effect down ticket. I don't know if that's even true, honestly. I don't think that's true. I don't think it is either. I think
that's why the Democrats get their butts kicked all the time.
Yeah. If Democrats put candidates up that actually represented all of the progressive policies that they want to see enacted, and then were able to actually follow that up with enacting said policies, I not only think they'd win more elections, but they'd probably win over a good chunk of those middle of the road voters that they're afraid of losing, because they would see the benefit of those policies. And I try to fall in the middle as much as I can on everything, but it is impossible in 2021 and 2022 to look at the current state of affairs in our current U.S. system and not see there being gigantic, glaring, gaping holes everywhere that need to be fixed. Whether it's the healthcare system, whether it's the way, frankly, the way labor is kind of shifting right now, jobs, income inequality, housing. There are just so many different issues that need to be addressed. And Republicans aren't interested in changing the way any of those things systemically work. Or progressives, rather, are pretty much the only ones who want to make significant changes to those things. And I promised you, I promise anybody listening, that if those elected individuals were given the opportunity to make those changes, they would win voters over. They would win people over because the policies would make a difference in the average person's life. It really would.
I don't understand why this is, but the Republican Party leadership follows the voters. Nobody in Republican Party leadership wanted Donald Trump to be president until it became obvious that he would be, or at least would be the nominee. At which point, the Republican leadership, the donors, the big money people, the people in the smoke-filled rooms all saluted their flag and said, Donald Trump. Democrats, on the other hand, their party leadership is constantly at war with their constituency. We have a constituency that wants to move to the left, and the Democratic Party leadership always wants to bring it back to the middle. I've brought this up time after time. Look at the nominees for president that the Democratic Party have put up. Almost every case over the last 40 years or more, it's been the least progressive candidate. Joe Biden was far less progressive than almost anybody else in that race. Barack Obama wasn't a terrifically progressive candidate. He was less so probably than Hillary Clinton, and he gets elected. The other problem that the Democrats face is a messaging problem, because they can't get their news out because they don't have talk radio, they don't have Fox News. Their efforts to build a messaging infrastructure have largely failed. They're already conceding the 2022 midterms, and obviously history shows that the party in power tends to lose seats. But right now we have a booming, thriving economy. It's the economy, stupid, Bill Clinton's advisor said. Was that Carville, I think? But is that message getting out anywhere? All we get is, oh my God, inflation, oh my God, gas prices, and socialism, which is a philosophy of government that's been adopted by practically every nation on earth, is seen in the United States as a terrible thing because the right has framed it that way, and the left has no way to cut through that framework and say, these are what these things are. The bill that's stalled right now, the Build Back Better bill that's stalled, what do we hear about it constantly? What it costs. How much do we hear about what's in it, what it would do for us? Nothing. They've got to come up with some kind of way to get their message out in an effective way, or voters are just going to go, they're just a bunch of socialists and they want to spend money. And, you know, have you seen those I did that Joe Biden stickers that people are putting on gas pumps? The other day, the news came out that first-time unemployment claims hit a 52-year low. I tweeted, where can I get a Joe Biden sticker for that? I mean, if you're going to blame him because gas prices went up and because inflation went up, which of course inflation's going to go up when a dead economy begins to reheat, and I'm not trying to be a lefty here and plug Joe Biden. I'm just saying that either if everything bad is the president's fault, then everything good ought to be to his credit. And the message that gets out to the vast swath of the American public isn't that. It's all about the negative, and it's not about what's in this bill that would help a lot of people.
You asked, how do you get the message out, and how do you compete with commercial terrestrial radio, which obviously is running a lot of conservative talk shows and things like that. Republican listeners are going to turn around and say, well, wait a second, Democrats have NPR. They get to do that too. I would say that, and this is probably the biggest problem, is how do you effectively communicate that? Forget about the vessel by which you're using to communicate it. How do you take a party that's becoming more academic by the day and take the message that they're creating and convey that to a population at large, especially those in the middle or those who may slightly lean to the right or do fully lean to the right and you want to convert, that are also becoming, frankly, to put it bluntly, less and less educated by the day? How do you convey that message? And I don't mean that to say that anybody on the right is stupid. I'm saying, like, literally, as education continues to be eroded, and it has been getting eroded in the U.S. for the last 30 years, how do you get that message out or effectively communicate it when it is a very academic argument by nature?
That's why there's been so much distrust of people like Dr. Fauci, because, they're just academics and eggheads. I would start, if I were a Democratic campaign strategist, start with some message discipline. I mean, you remember in the early 90s, I think it was, when Newt Gingrich was Speaker, he came out with that pamphlet about language, and he had suggested words that Republicans should use about Democrats. And in lockstep, they went out and used those words. If I were in charge of the Democratic Party for 5 minutes, I would say, your order today is every time you talk about the Republican Party, you refer to them as the party of obstruction. Every single time, every single politician, all across America. Would it work? I don't know, but it might be a start. And say, because in my humble opinion, that's what we have, the Republican Party. Every Democratic president comes in and says, I'm going to be a changer. I'm going to bring people together. Obama said it. Biden's saying it. And if you're the opposition, all you have to do is block everything, and he can't succeed. Because you come in, I'm going to reach across the aisle. I'm going to do all these great things, block it all, and then at the end of 4 years go, he didn't do anything he said. Vote for us.
They have to find a way, progressives have to find a way to get progressive policy into places that it is not typically being pushed. So there is so much energy and so much focus around cities and urban areas where Democrats have, for the most part, strongholds, right? That energy and those policies need to make their way down to rural communities. And I don't think, it's money, right? Like, realistically, it's money. Democrats need to come up with some policies that are going to get money into rural communities and rural voters' hands if they want their message to ever be taken seriously.
But see, they have. I mean, look at all the stimulus money that went to all these people who hate socialism. The Iowa diner guy with his John Deere cap, he hates socialism, but I'll bet you he cashed his check that he got from the government. Study after study has shown when you give a voter a list of Democratic policy proposals, they are generally pretty popular. When you tell that voter that they're Democratic proposals, they become way less popular. We have people who would favor something if they didn't know it was Joe Biden's idea. If Joe Biden, you want to end the pandemic, Joe Biden should go on TV and go, vaccines stink, don't get them, I hate them, they're the dumbest thing in history, and everyone on the right would rush out and get one tomorrow and we'd be done.
Yeah. So I would say this in response to the whole stimulus thing. How different do any of these communities in the Finger Lakes look because of the stimulus? I would say the 3 rounds of stimulus checks that went out made the concept of stimulus more palatable to more people. And that, I think, is probably a win. When you're talking about, like, overall, if you're a Democrat and you believe in things like universal basic income, getting money into people's hands is a start, right? Like that, it will, but as with a lot of things, takes time, right? You got to keep going. I think the next big thing would be for these communities to start to look differently. And they don't. Like, we haven't seen, there's been this influx of money, right, into people's pockets, but Does downtown in any community that hasn't gotten a DRI grant in the last 5 years look any different? Do the small towns and villages and hamlets, do they look significantly better now because of this? The quote unquote progressive policy needs to have a rehabilitative effect on not just the cities and the inner city neighborhoods that have been forgotten for the last 30 years, but also for the rural communities that, because of the loss of industry, have also been forgotten for the last 30 years and now rely on something as inconsistent as tourism, and we're going to talk about that next.
Yeah,
as a lifeblood for it, and it's just not sustainable. Get those
you make a
policies
good point. The decline, though, of small town America way predated COVID and is a much bigger issue. And it's interesting because you mentioned these progressive policies. When you think about it, stimulus is basically guaranteed income. We were talking about this off the air, I think, here in the office yesterday, that the cynical side of me wonders if progressives aren't kind of taking advantage of COVID to put through some ideas that normally would never get put through. Pause in student loans, telling people, rent forgiveness. Those are pretty liberal things that have sort of snuck in the back door while nobody was watching.
But because of the economic circumstances of 2020, were absolutely necessary, right?
And we're seeing, we'll get into this probably in a future episode, there was a story just the other day that many states right now are rolling in cash and have budget surpluses and don't know what to do with it because of all this influx of money. And then we had the change in the labor market where we went from it was hard to find a job to everybody and their uncle is advertising for $18-19 an hour. I mean, we're still trying to grasp all these changes that are happening that will make a great book for a historian 50 years from now.
Yeah, and to your point, like I was definitely not indicating that these issues that we're talking about, getting progressive policies into, or the benefits of progressive policies into small towns being a COVID issue. They certainly all predated COVID, and that's the point. I think, like, if Democrats want long-term success, that's how they start to widen their camp and start to bolster their party a little bit.
Well, they should start by being Democrats. I mean, if a Republican loses an election, it's because he wasn't conservative enough, and the next guy will be even further to the right. Yeah. When a Democrat loses, oh my God, you're too far to the left. I mean, look at all the grief that AOC has taken. Yeah. I mean, she was elected by a young, progressive constituency that wants social change faster.
Yep.
And she just gets nothing but grief over it.
So kind of connecting to what we were just talking about a few minutes ago, Radisson Hotel Corning says that in response to COVID-19 and the realities that the pandemic has brought on, they will be closing in January and February. So let me summarize that one. Big hotel, big fancy flashy hotel in the Southern Tier, in one of the Southern Tier's biggest cities and only economic drivers, is closing for 2 months and becoming a seasonal business.
I don't know. This is it's hard to fathom. First off, who's going to be left to work there when they open in 2 months? I haven't seen in the story, what are they doing with their employees? I assume they're not being paid for 2 months. So are they going to have a staff when they reopen? That's a hard one to fathom for me, because in talking with a lot of the tourism officials, and I used to have a number of them on the radio, and actually we'll have some coming up on Inside the FLX in a week or two, they say tourism overall is doing pretty well. It's changed. So instead of people coming in from 600 or 1,000 miles away, now it's more Pennsylvania, New York City. The circle has closed. More people are doing staycation types of things. So I mean, I'm sure somebody was good at crunching numbers and said, okay, this makes sense. It just seems like a really odd way to do business. I mean, is this the new, are we going to see more of these things? I mean, some of the wineries, not all the wineries stay open over the winter because the traffic doesn't support it. Not as many people are out taking leisurely drives when it's 11 degrees outside. But that just, when I saw that, it was a head scratcher. I just really don't get it.
Yeah, I think there's the assumption that tourism, at least the Finger Lakes and upstate New York's brand of tourism, can be a year-round thing. except the reality is probably that it's as seasonal as, say, skiing and snowboarding. There are going to be down periods, and unfortunately, the only real downside here is for the region and the region's economy, because most of it is based around tourism. And if you have a bunch of businesses that are either scaling back or closing for a month or two or whatever the case may be, you really damage the fabric of that community and how it operates. I can recall a bakery and coffee shop a few years ago in Seneca Falls, I think it was. Yeah, it was Seneca Falls, that had essentially decided that they were going to close for a month after 2 years of business in January because it was just so slow. And on paper, it probably looked like the right thing to do, but that bakery and coffee shop isn't there anymore. So you see, like, long term what that can do and how that kind of starts the process. People expect everything to be there all the time, not just occasionally.
I mean, I think there's probably less brand and business loyalty than there used to be. So if a bakery shuts down for a month, I'm going to go somewhere else to get my baked goods. And if I like it, I'm probably going to keep doing it when the first place opens. I mean, people, I don't know what the hotel picture is in Corning. I'm not sure what else there is for hotels. I'm sure that, that whole area, Corning Painted Post, is a major intersection of the interstate, so there's probably some of the other fairly high-end chains there as well. So do people who would have stayed at the Radisson go somewhere else and go, hey, this Hilton's not bad, I'll go to Hilton from now on?
Yeah, and I mean, I think the rise of Airbnbs has also changed the game for a lot of these big brands with a lot of overhead. And I think also there's probably a bit of a business model minutia to kind of dig into there as well. What is the business model of, say, a chain like a Hilton Garden Inn or Fairfield Inn or something like that compared to, or Hampton Inn compared to a Radisson? Business model is probably a little different.
And I'm wondering, too, using the word business, how much of the clientele at the Corning Radisson is tourists and how much of it is people working who are now not going to meetings in person. Instead, they're meeting by Zoom, or they're not working in the office, they're working from home. I'm wondering how much this has to do with the change in the way we're working. It may not be so much a tourism issue as it is many fewer people are flying around the country, going from office to office or plant to plant for in-person meetings, so they don't need to stay overnight anymore. They get on Zoom and do their business from their living room.
Valid, and I think it probably is a reality of that. Last topic of the day, we've got a little guaranteed income to talk about. A program was launched in Ithaca. It's called their Guaranteed Income Initiative, and the goal of it is to research the benefit of giving unpaid caregivers essentially a stipend of $450-ish a month. It's privately funded. It's not universal basic income. None of those things. What do you think the benefit is there? And I actually saw that Rochester rolled out and approved last night at their city council meeting a similar measure, not for caregivers, but essentially a guaranteed income pilot program to test out. Ultimately, we are testing the waters here of universal basic income. What are your thoughts on seeing these little pilot programs pop up?
Well, I guess I'm not sure why they're really calling this guaranteed income if it's to pay caregivers. It sounds more like it's paying people for something they probably should have been paid for all along. I mean, and I'm not sure the time is right now because the economy is thriving. I mean, if you're opposed to this kind of thing, you point to all those help wanted signs and say there's jobs out there for the taking. Why do we need to give people money? Because when I think of guaranteed income, I think of getting money for no reason, that you don't do anything. If you do something to earn money, they call that a job. So I'm not sure when they talk about unpaid caregivers, are they talking about people taking care of elderly in their own family?
Yeah, I think that's the angle of this, and that has been something that a lot of there have been some commercial enterprises that have tried to address that. But there hasn't really been any effective, say, a family member long-term ill, can't get into the nursing home or whatever the case may be, or perhaps you just don't want to have that individual go to the nursing home. They're either unable to work full-time or only able to work part-time or whatever the case may be. So this would, in theory, be kind of filling a gap, I suppose. It's interesting, I think, because at the end of the day, and you talk about a booming economy, you talk about wages being higher than ever, but wages still aren't in line with people being able to meet the quote-unquote basic essentials of American life. So being able to afford and buy a house, being able to afford and maintain all of the other things, healthcare, transportation, all of these things that are very expensive, wages still aren't in line with being enough. So, is this step one towards a universal basic income? I think, again, stimulus, it definitely warmed people up to the idea. I think more of the population is open to the idea of getting a small or medium-sized check from the government every month to balance things out if the price of goods is not going to be controlled. I mean, the reality is like you either have to give, using housing as an example, at some point here, wages are either going to increase to a point where a $300,000 house in a place like Ontario County is normal, and that probably will happen at a snail's pace, or you could alternatively control how much a house could potentially sell for. One of those two, and both of those things are opposed by different groups of people for different reasons. But at the end of the day, either you're going to have to control the cost or you're going to have to control the spend or add to the spend for the individual.
But I think the problem is still the gap, because there are plenty of $300,000 homes in Ontario County. Drive up to Farmington and Victor right now, and you'll see entire farm fields being turned into those developments. So somewhere there are people who make plenty of money to afford those houses, and at the other end there are people who can't afford enough money to keep their 87 Dodge Dart running and are living in an apartment where the roof leaks and the landlord won't fix it. I mean, it's that gap, I think, between the people that live very comfortably and the people who can't meet basics. But as to your question, I think that maybe this is the way you kind of sneak guaranteed income through the back door by calling it sort of something else. Well, this is to pay caregivers. The same way, when we called stimulus. So maybe the Democrats do have some messaging that I hadn't really thought about, because when you call something stimulus, apparently it's pretty much okay with everybody. If you just called it a government check, it might not be so popular.
Yep. Yeah, and I don't necessarily know that we're to the point where we've hit critical mass on enough people being behind it. But again, as long as stimulus stays in the headlines, as long as these different kind of like child tax credits, things like that, as long as all these things continue to stay in the headlines, people are going to keep warming up, and eventually it'll get there, because I don't foresee any systemic changes coming in our economy that are going to make any of these, essentials in American life more attainable for people who are making up a bigger chunk of the bottom of the totem pole.
But if the 2022 midterms go as most people expect, if the Republicans gain one or both houses of Congress, then all this kind of stuff is going to come to a grinding halt at the federal level, and it'll be up to states and communities to try to push that agenda forward, because it'll get nowhere at the federal level if that happens, as seems more likely than not at this point.
Yeah. And just like that, we did it again.
All right. We'll have more COVID, I'm sure, next week. And follow all the news at fingerlakes1.com. For Josh Durso, I'm Ted Baker. Thanks for watching, and we will talk to you next week.